Hello everyone. Today's my lecture is on white blood cells. And the learning objective of these lectures are first of all introduction, then differences between WBC and RBC, normal count of WBC, classification of WBC, then leukopoiesis and lifespan of WBC, then life history of WBC and properties of WBC. And questions related to the WBCs are classify the white blood cells, list the stages and regulation of leukopoiesis, then describe the functions of the white blood cells, then describe the physiological and pathological variation of the total white blood cell count. Our body that are exposed continuously to the bacteria, viruses and fungi and parasites, all of which that occur normally and to varying the degrees in the skin, the mouth and the respiratory passageway and the intestinal tract and the lining membrane of the eyes and even the urinary tract. Now, many of these infectious agents are capable of causing a serious abnormal physiological functions or even death if they invade in the deeper tissues. We are also exposed intermittently to other highly infectious bacteria and viruses besides those that are normally present. And these agents cause acute lethal disease such as pneumonia, streptococcal infection and typhoid fever. Our body that have a special system for combating the different infectious and toxic agents, and this system is composed of leukocytes and tissue cells derived from the leukocytes. And these cells work together in two ways to prevent the disease: by actually destroying the invading bacteria or viruses by phagocytosis, and by forming antibody and sensitized lymphocytes that may destroy or inactivate the invader. Now, leukocytes is also known as white blood cells, and that are the mobile units of our body's protective system. They are found partially in the bone marrow and partially in the lymph tissue. After the formation, they are transported in the blood to the different parts of the body where they are needed. Now there are certain differences between the WBC and RBC. So first of all, WBC, they do not contain any hemoglobin. They are bigger in size. They are nucleated living cells and they are actively amoeboid. They are much less in the number and their lifespan is shorter than the RBC. So these are the differences between the WBC and RBC. And their origin is purely extravascular tissues and their functions are absolutely different from those of the red blood cells, and there are several varieties of the leukocytes whereas the red blood cells are only one variety. Then what is the chemistry of the leukocytes? So leukocytes are rich in nucleoprotein and also contain lipids, glycogen, cholesterol, ascorbic acid and variety of the enzymes, especially proteolytic. Then total number. The average total number of the white blood cell is 6000 to 8000 per cubic millimeter. The normal range being 4000 to 11,000 per cubic millimeter. The average ratio of the total white cell count with the total red blood cell count is about 1:700. Means the 1 WBC there is a 700 RBC. Normal white blood cell count, that is about 4000 to 11,000 per cubic millimeter of the blood. Then differential WBC count. So differential WBC count. So granulocytes in which there is a neutrophil. So differential count of the neutrophil which is about 40 to 75% and absolute neutrophil count that is about 2000 to 7,500 per mm cube. And differential count of the eosinophil, that is about 1 to 6%, and absolute eosinophil count, which is about 40 to 440 mm per mm cube. And differential count of basophil about 0 to 1%, and absolute count, which is about 0 to 100 per mm cube. And in agranulocytes, in which first of all lymphocytes, the differential count, which is about 20 to 40%, and absolute lymphocyte count 1500 to 4000 per mm cube. And differential count of monocyte, which is about 2 to 10%, and absolute monocyte count, which is about 500 to 800 per mm cube. Now, what is the clinical significance of differential WBC count? So, differential WBC count is done to find out which type of the WBC are increased or decreased. And in different disease, different types of the WBC increases. For example, in acute infection, there is an increase in the number of neutrophils. In allergic conditions, there is an increase in the number of eosinophils. Absolute count and its clinical importance. So, absolute count is the number of the particular type of the WBC per cubic mm of blood. If the differential count shows increase in the number of any type of the WBC, it may be a relative increase and not an absolute increase. For example, increase in one type of the cell may be due to relative decrease in other type of the WBC. Therefore, to know the actual decrease or increase in the number of particular type of WBC, absolute count is necessary. Now the classification of WBC. Some of the WBC have granules in the cytoplasm. Based on the presence or absence of the granules in the cytoplasm, the leukocytes are classified into two groups: granulocytes which have granules and agranulocytes which do not have granules. Then granulocytes. Depending upon the staining property of the granulocytes are classified into three types: neutrophils with the granules taking both acidic and basic stains, eosinophil with granules taking acidic stain, basophil with the granules taking basic stains. Now agranulocytes. Agranulocytes have a plain cytoplasm without granules. Agranulocytes are of two types: monocytes and lymphocytes. Now leukocytosis. So leukocytosis refers to increase in total WBC count above 11,000 per mm cube. Then what are the causes of leukocytosis? So first of all, age. In newborn baby up to the age of 1 year, the WBC count is higher, and at birth the WBC count is about 18,000 per mm cube, which drops gradually to the adult level. And exercise. WBC count is increased after the exercise. Then after food intake, the WBC count is raised. Mental stress and emotional condition like anxiety are associated with the increased WBC count. Then pregnancy. At full term pregnancy, the WBC count is increased up to 12,000 to 15,000 mm cube. Then exposure to low temperature also causes leukocytosis. Then what are the pathological causes of leukocytosis? So these are acute bacterial infections, especially by pyogenic organisms, acute hemorrhage, burns, postoperative period, tuberculosis and glandular fever. Then leukopenia. Leukopenia refers to decrease in the total WBC count below 4,000 per mm cube. Then causes of leukopenia are infection by non-pyogenic bacteria, especially typhoid fever and paratyphoid fever, viral infections such as influenza, smallpox and mumps, protozoal infection. Then starvation and malnutrition. aplasia of bone marrow, and bone marrow depression due to drugs such as chloromyocetin and cytotoxic drugs used in malignant disease. Then repeated exposure to X-ray or radiation. Chemical poisons like arsenic, dinitrophenol and antimony. Then another terminology is leukemia. So leukemia is a malignant disease of the blood in which there occurs an increase in the total WBC count associated with the presence of immature WBC in the peripheral blood. And the total WBC count usually above 50,000 per mm³ and it may be as high as 1 lakh to 3 lakhs per mm³. Then what are the site of formation of leukocytes? So granulocytes and monocytes are formed in the red bone marrow. Then lymphocytes are produced in the various lymphogenous organs including lymph glands, spleen, thymus, tonsils and lymphoid tissue in the bone marrow and gastrointestinal tract. Then genesis of the white blood cells. So stem cell. So what are the stem cells? So stem cells are the primary cells that are capable of self-renewal and differentiating into the specialized cells. Hemopoietic stem cells are the primitive cells in the bone marrow which gives rise to blood cells. Then hemopoietic stem cells in the bone marrow are called uncommitted pluripotent hemopoietic stem cell. Pluripotent hemopoietic stem cell is defined as a cell that can give rise to all the types of the blood cells. In the early stage, pluripotent hemopoietic stem cells are not designed to form a particular or specific type of the blood cells. And it is also not possible to determine the blood cells to be developed from these cells. So its name is uncommitted pluripotent hemopoietic stem cell. In adult, only a few number of these cells are present, but the best source of these cells is the umbilical cord blood. When the cells are designed to form a particular type of the blood cells, the uncommitted pluripotent hemopoietic stem cells are known as committed pluripotent hemopoietic stem cell. Committed pluripotent hemopoietic stem cell is defined as a cell which is restricted to give rise to one group of the blood cells. Now committed pluripotent hemopoietic stem cells, that are two types. First is lymphoid and natural killer cells, then colony forming blastocytes stem cells which give rise to lymphocytes which give rise to myeloid cells. Myeloid cells are the blood cells other than the lymphocytes. When grown in cultures, these cells form colonies, hence the name colony forming blastocyte. Then different units of the colony forming cells are colony forming unit erythrocytes. Cells of this unit develop into erythrocytes. Colony forming unit GM. GM means granulocytes and monocytes. These cells give rise to granulocytes, neutrophil, basophil, eosinophil and monocytes. Colony forming unit megakaryocytes. Platelets are derived from these cells. So, this is a figure. First of all, uncommitted pluripotent hemopoietic stem cells, then it committed pluripotent hemopoietic stem cells, and there are two lymphoid stem cells. From there, lymphocytes developed and colony forming blastocytes, three types: colony forming unit E, colony forming unit GM and colony forming unit megakaryocyte. So from the colony forming unit E, erythrocytes or red blood cells develop, and colony forming unit GM, granulocytes from three cells neutrophil, basophil and eosinophils are derived, and colony forming unit GM, M, monocytes are also developed. Colony forming unit M, from that platelets are developed. So stages in leukopoiesis. So colony forming unit GM. First of all, myeloblast. In myelocytes are two types, promyelocyte and monoblast. So monoblast, that from that promonocyte, and from that monocytes are developed. Then promyelocytes, there are three types, neutrophil myelocyte, basophil myelocyte and eosinophil myelocyte. Then from the myelocyte, neutrophil metamyelocytes developed, and finally the mature neutrophils are developed. From the basophil myelocyte, basophil metamyelocyte, and then finally basophils are developed. And eosinophil myelocyte, from that eosinophil metamyelocyte, and then finally mature eosinophils are developed. And from the lymphoid stem cells, lymphoblast, and then from the lymphoblast, finally the lymphocytes are developed. And that is a colorful figure of various stages in leukopoiesis. Then the regulation of leukopoiesis. Leukopoiesis is mainly regulated by cytokines, especially the colony stimulating factors, interleukins and tumor necrosis factors. T lymphocytes, monocytes, fibroblast, endothelial cells, liver and kidney, that are the major source of the hemopoietic growth factor. Interleukin. So interleukin 1, interleukin 6 and interleukin 3 promote the maturation of the stem cells. Interleukin 5 helps in the development of eosinophil, and therefore interleukin 5 is also known as eosinophilic growth factor. Interleukin 3 and 4 facilitate the development of basophils. Interleukin 2 inhibits the myelopoiesis. Then colony stimulating factors. The important colony stimulating factors that influences the leukopoiesis are GM-CSF, G-CSF and M-CSF. Then GM-CSF. So this is the granulocyte monocyte colony stimulating factor secreted by the fibroblast, vascular endothelial cells, monocytes and T lymphocytes. GM-CSF, that stimulates the differentiation and proliferation of the pluripotent stem cells into the committed cells. GM-CSF also helps in the differentiation of the colony forming unit into granulocytes and monocyte precursors and their further development into mature cells. It synergizes with the interleukin 4 to produce dendritic cells. Then GCSF. This is the granulocyte colony stimulating factor. It is produced by monocytes, endothelial cells and fibroblast. It helps in the development and functions of granulocytes. Then monocyte colony stimulating factor. It is also known as colony stimulating factor 1. It is produced by fibroblast, endothelial cells and macrophages. It promotes the proliferation of monocytes and macrophages and also stimulates the function of monocytes. Then tumor necrosis factor, that helps in the proliferation and differentiation of the stem cells. Then role of prostaglandins. Prostaglandins formed by monocytes, lactoferrin and possibly some other agents play a role in the control of leukopoiesis. Now in this table, these are a list of types, then sources and various functions of the growth factors. Then properties of the white blood cells. So diapedesis. What is the diapedesis? So it is the process by which the leukocytes squeeze through the narrow blood vessels. Then amoeboid movement. Neutrophil, monocytes and lymphocytes show the amoebic movement characterized by the protrusion of the cytoplasm and change in the shape. Then chemotaxis. Chemotaxis is the attraction of the WBC towards the injured tissue by the chemical substances released at the site of injury. Then lifespan of the WBC. So granulocytes released from the bone marrow and remain in the circulating blood for 6 to 8 hours, and then they enter into the tissue where they lie for about 4 to 5 days. In cases of the severe infection, the lifespan may become as short as few hours. Monocytes have short time in the circulation, but in the tissue they get converted into macrophages and can live for a few months or even for a year unless destroyed while doing the phagocytic functions. Lymphocytes remain in the circulation for a few hours, then pass to the tissues and re-enter the blood through the lymph. They have lifespan of months or a year depending upon body's need for these cells. Now lifespan of the leukocytes in different phases. Bone marrow phase in the peripheral blood and in the tissues. So in the bone marrow there is a proliferative or mitotic pool. So in this there is a progenitor cells, myeloblast, promyelocyte and myelocyte. And then there is a maturation pool, metamyelocyte, bent segmented neutrophil, then storage pool, there is a bent and segmented neutrophil. Then in the peripheral blood, so in the bone marrow phase, the lifespan that is about 6 to 10 days. Now in the peripheral blood, it is about 6 to 8 hours. Lifespan which is about 6 to 8 hours, and in the circulating pool it is about 50% and marginating pool there are about also 50%. And in the tissue, the lifespan of the WBC that is only about 4 to 5 days. So life history of leukocytes. Leukocytes have mainly three phases in their life: marrow phase, the circulation phase and tissue phase. So marrow phase. This is the phase of the development in the bone marrow, hence it is also known as development phase. Marrow phase has two pools, mitotic pool and maturation pool. So mitotic pool, the development from the myeloblast to myelocyte is the phase of mitotic pool as the cells undergo mitosis in this stage. So this is the mitotic pool. Then maturation pool. So this is the phase of the maturation of the metamyelocyte into mature cells. Cells do not undergo mitosis in this stage. So from metamyelocyte to mature cells. Duration of the leukopoiesis. From the myeloblast to matured leukocytes, the process of the development usually takes about 10 days. About 5 days they are spent in the mitotic pool development up to myelocyte. So from here to from here, myelocyte, that is a mitotic pool. Then another 5 days are utilized in the maturation pool. So means development from the metamyelocyte to mature cells, from metamyelocyte to mature cells. Then circulation phase. The mature cells are released into the circulation and remain in the circulation for few hours before they enter into the tissue. That is a circulation pool. At rest, many leukocytes, especially the neutrophils that adhere to the endothelial lining of the blood vessels, which is known as margination pool of leukocytes. In addition, the leukocytes actually circulate in the blood. that is an active circulation pool. Then disruption of the margination that causes leukocytosis. Leukocytes that adhere to the inner lining of the blood vessels, that is known as margination. In exercise and other conditions of the increased hemodynamics, the leukocytosis occurs mainly due to disruption of the margination of leukocytes. Then tissue phase. After their activities in the circulation, the leukocytes enter the tissues. This is called tissue pool of leukocytes. Granulocytes live for few days in the tissues, whereas the monocytes remain for a longer period. In the tissues, monocytes are transformed into the tissue macrophages that remain for many years. Then apoptosis of leukocytes. Apoptosis means the programmed cell death. This is a physiologic phenomenon of the elimination of the mature cells from the body. Biochemically, the apoptosis occurs due to internucleosomal DNA fragmentation, and morphologically by nuclear and cytoplasmic condensation. The apoptic cells are phagocytosed by macrophages. Then neutrophils and eosinophils undergo apoptosis. Thank you very much.